Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. Here in Module 6, we will explore options for sharing the results of your study. In this module, we will describe the importance of communicating your study results, discuss possibilities for disseminating results inside and outside your institution, offer general tips for more effective podium presentations, and craft a few illustrative slides using the first clinical example from Module 2. Disseminating your study results is an important aspect of science. In reporting your findings, you may help to inform clinical practice, perhaps play a part in changing policy, affect patient care, and even affect costs associated with clinical care. Apart from these benefits, you may also be able to educate colleagues on your unit's current projects, initiate and sustain research-related collaborations, enhance your role as an inquisitive clinician, and facilitate your overall growth as a communicator. Once you've completed your study, there are several options for communicating your results. For example, you could hang a poster in a prominent place in your unit that highlights your project. You could also discuss your results and their implications during a regular staff meeting or even during a daily huddle. Another excellent way to share your findings is to present at a grand rounds or similar event in your institution, or to present at manager and/or director level meetings. In addition to presenting inside your institution, you could submit an abstract for a poster or podium presentation at a national conference, a topic we will cover more in depth in Module 8. You could also submit an abstract for local and regional conferences, as well as offer to speak at comparable nearby institutions. Now that you know about options for dissemination inside and outside your institution, let's go over a few tips for more effectively communicating your findings, in particular via PowerPoint presentation. Remember to use text sparingly on each slide. Too much text is difficult to read and may be distracting. Make good use of visuals, that is, employ key images that vividly tell your story to the audience. Make sure the length of your presentation is appropriate, and that you'll be able to cover all or most of your material within the time allotted. When it comes to speaking, don't rush. Try to use a natural speaking voice and comfortable tempo, which tends to create more of a conversational feel and tone. Also, you should not underestimate the importance of knowing your audience. Know what they expect to hear and see, and how they will expect information to be conveyed. Some other common sense tips include making regular eye contact and avoiding distracting behaviors such as fidgeting or excessively long pauses. With this advice in mind, however, remember to also have fun. For our illustrative example of a podium presentation, we'll use the first clinical question from Module 2. In that project, we looked at how sodium and exercise may influence blood pressure over time. On your opening slide, you'll want to insert a short but informative title, something along the lines of Effects of Sodium Intake and Physical Activity on Blood Pressure. Just below your title, you'll insert the names of the study authors and their affiliation. After your title slide, you'll typically provide an overview. Here is where you'll enumerate the sections of your talk, starting with the background and literature review, or why sodium intake and exercise matter, then the study purpose and hypothesis, or why you did what you did and what idea you tested, followed by the methods, or how you designed your study and collected data, capped off by the results, or a summary of your major findings, and the discussion, or what your results could mean for clinical theory or practice. In the background section, usually in bullet point format, you'll want to describe prior studies on your topic. This will include what other clinicians and researchers have tried with respect to understanding your phenomenon of interest, perhaps in reference to study design and possible interventions. You'll also explain to the audience what is still not known about your topic and specifically how your study will add to this body of knowledge. Next, in the methods section, you'll go into detail on how you did your study. Again, in bullet point format, you could outline the following. An observational prospective study followed 2 groups of patients in a cardiovascular unit for 1 year. It involved one group of 50 subjects who took in a clinically standard allowance for sodium and directed their own exercise routine, and another group of 50 subjects who took in 20% less sodium than the clinical standard and increased their daily number of physical activities. Primary metrics were average daily, weekly, and monthly blood pressure. Secondary metrics were physical stamina and range of motion. After your methods, you'll report your key results. While presenting a table such as the one illustrated here, you could verbalize the following summary. Ending mean systolic and diastolic BP readings were significantly lower for patients with decreased sodium and increased exercise. Ending mean stamina and range of motion for knee flexion were significantly greater for patients with decreased sodium and increased exercise. You could wrap up your results section with a graph. In this case, you'd point out that the vertical axis represents systolic blood pressure and that the horizontal axis represents time. While showing the graph, you could verbalize the following. Mean systolic BP was significantly lower for patients with decreased sodium and increased exercise in months 6, 9, 10, 11, and 12. There were no other statistically significant differences between the two groups at any other time points. At the close of your talk, you'll discuss the implications of your results, again in bullet point format. You'll provide some context for your audience on what your results could mean. In this case, you could list the following items. We noted positive effects of altering diet and exercise in our study. Decreased sodium intake and increased exercise led to significant decreases in patient blood pressure as well as improved stamina and limb flexion. This suggests that altered diet and exercise may minimize hypertension and enhance overall well-being. Now that we've gone over options for disseminating your findings, we'll ask you to reflect on what you've learned. What are some of the most notable benefits of sharing your study results? Some of the major benefits are that you will better inform your colleagues, you could perhaps change patient care policy, and you may also affect costs associated with clinical care. What are a few options for presentations either inside or outside your institution? Inside your institution, you could place a poster in your unit or discuss your results during regular staff meetings. Outside your institution, you could submit an abstract for a poster or podium presentation at a regional or national conference. True or false? For a podium presentation, it's important to know your audience and avoid jargon whenever possible. The answer is true. You should have a good understanding of what your audience expects to see and hear and strive to communicate your findings clearly and concisely. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed Module 6.